So same-day emergency care is making sure that wherever possible and clinically appropriate, patients who can be managed with an acute problem on the very day that they first present are managed on that day, so they go home without having to be in hospital overnight.
We know that patients really love it because it enables them to get on with their lives, and it also helps us to free up some flow in the acute care system to allow us to manage patients who are critically unwell when they need us most.
Front and centre within the long-term plan is same-day emergency care. So the priority is keeping it front and centre and at the top of everybody's priorities.
Particularly for same-day emergency care, the long-term plan focuses on the delivery of 12 hours a day, 7 days a week. It's for 70 hours a week for acute frailty, and also implementing the same-day emergency care data set across hospitals in 2020.
In the long-term plan, there is a complete commitment by the wider NHS to deliver this on a 7-day-a-week basis. The incentive is therefore one of opportunity, but also an imperative that actually we have committed to delivering this and people will be held to account to make sure they are.
We've been practicing SDEC since 2012, and it's something that we really as a team truly believe in, because it's about trying to make the acute flow much more efficient, safe, better experience for patients and staff, but it's also much more intuitive in terms of trying to avoid unnecessary multiple steps in the patient's acute pathway.
Same-day emergency care agenda is very much linked to the acute frailty agenda, and the two are closely tied in with one another.
We started very small, and our Chief Executive very quickly saw the benefit of SDEC delivery and invested in our brand new SDEC purpose-built unit.
It's an act of faith for people who are running hospitals to put the money on the front door, because same-day emergency care sometimes isn't cheap. It needs additional diagnostics, additional rotas, additional staff. But if that can prevent patients coming into the hospital, it avoids the costs further downstream of patients who become stranded in the hospital, which is bad for the patients, but is also bad because it's additional beds that they have to keep open.
It is a new way of working, and with that comes challenges around how people have to work. But it's absolutely the right thing to do, because it's the right thing for patients, and it's the right thing for staff as well. And as a result of that, staff experience, patient experience, relative experience is going to be so much better.
If you feel that this isn't the sort of thing that's suitable for your hospital, I can guarantee that we'd be able to give you exemplar sites of hospitals very similar to yours, both in terms of geography, case mix and skill mix, that are delivering high volumes of same-day emergency care, which is much better for that hospital and those patients who need to get into the hospital.